Hello, I'm Maureen Jansen from Head and Neck Cancer Support Aotearoa. I'm here to ask a question about immunotherapy. It's Keytruda that is approved but not funded in New Zealand, and a number of people seem to use it as a last resort. They have to use up their life insurance, they have to fund on give a little, and it hardly ever seems to work. But lately I've met a couple of people for whom it has been successful, and I'm asking if there are factors apart from the biomarkers that indicate a successful treatment with Keytruda. Is it something to do with where and how the cancer spread? Is it to do with how well defined the cancer is? Or combinations? Thank you.
Maureen, thank you so much for that question. And I also just want to say a special hello to everybody in Aotearoa, New Zealand, who are with head and neck cancer or members of multidisciplinary teams. And thank you so much for joining us for this series of videos. If I could come to you, Vanessa, how would you respond to Maureen's question? And also if you could explain terms like biomarkers and so on.
So I guess we can start with the term biomarker. That's really an indication in someone's body, either an indication from their tumour or their blood, that they might benefit from a certain treatment, okay? And we use them across all types of fields in oncology, and they differ depending on the type of cancer we're talking about. But I think the biomarker that she's referring to is a biomarker called tumour proportion score, okay? And we look at the cells in a biopsy and we do a special stain on those cells. And if they stain strongly for this marker, then that has been shown in trials to predict for patients who are more likely to get benefit from immune therapy. It is far from perfect, and that was, I think, what Maureen is alluding to. Are there more specific ways to identify patients who might benefit or not benefit from immune therapy? And the short answer is not really. There are a lot of theories and there is a lot of research going into this, because this is something that's applicable not only to patients with head and neck cancer, but all cancers where we use immune therapy. And really, there are not reliable characteristics in either the patient or the tumour that tell us that someone is going to respond or not respond. So that is the frustrating thing about immune therapy.